So prion diseases are these funky little things that we talk about with the viruses, but they are not viruses. In fact, a prion is a proteinaceous infectious particle. So it's literally a protein, a single protein that causes disease. Prion diseases can be sporadic, meaning they randomly occur. They can be genetic, meaning you have a genetic predisposition to them, or they can be acquired, meaning you are exposed to a prion at some point in your life and you therefore will develop the disease. What a lot of prions have in common, the ones we're going to talk about anyway, are that they damage the central nervous system. They cause what's called a subacute spongiform encephalopathy. And if we boil that down into easier to understand language, they turn your brain into a sponge. So it's very, very bad. What you can see on this table here is a comparison of a virus to a prion. So again, a prion is not a virus. It is literally a protein that causes disease. So it is small, obviously, it's just a protein. It does not have any nucleic acid because it's just a protein. They don't have a defined morphology. They do have protein. Can they be disinfected by formaldehyde? No. Can they be destroyed by proteases? No. Can they be destroyed by heat? No. Can they be destroyed by radiation? No. Do they cause cytopathic effects? No. What is their incubation period? Long, decades. Do you mount an immune response? Usually no. Do you mount interferon? No. Do you have inflammation? No. So these are a very insidious cause of disease, and most patients are not diagnosed until they already have very severe symptoms or have already died. In humans, the prion diseases that we're most familiar with are things like Kuru, Creutzfeldt-Jakob, something called GSS, which is inherited, fatal familial insomnia, which is also inherited, sporadic fatal insomnia. And then in animals, we call the disease scrapie in sheep and goats. There's a version in mink, transmissible mink encephalopathy. In cows, we call it bovine spongiform encephalopathy or mad cow disease. In some of our animals like mule, deer, and elk, we call it chronic wasting disease. So what all of these diseases have in common is that there is a normal protein called PRP, and it has a C as the superscript, PRPC. We don't really know what the function of this protein is normally, but this is the prion protein, the cellular form, the normal form. And it has a lot of alpha helices, and those alpha helices provide a lot of flexibility to the protein so that it can move around. It doesn't pack very tightly, etc. The abnormal form of the protein is called PRP, so prion protein scrapie, PRPSC. It's the prion form, the disease form. It is abnormal, and it has more beta sheets, and that allows it to pack really tightly together. And so what it tends to do, because it can pack so tightly together, is that it forms aggregates. It's multimeric. Those aggregates are what eventually cause the lesions in the brain that are the spongiform encephalopathy. When it is in this form, this scrapie form, it is protease resistant. It is found in cytoplasmic vesicles, in extracellular environments, and it takes forever to be turned over in the cells. So it sticks around forever. It packs really tightly. It forms these aggregates. It can't be destroyed. When we generally talk about prion diseases, what we all are more worried about is the kind that we can acquire. We don't really think much about the sporadic or inherited forms because they are so very rare. With the acquired forms, the infection can be through ingestion, breaks in the skin, direct inoculation into the brain through things like contaminated surgical tools. What will happen through either ingestion or breaks in the skin is that those prions, those misfolded versions of the protein, will accumulate in your nervous tissue, and travel up eventually to the brain. So here we see the pathogenic characteristics. We really don't see any CPE, very long doubling time, long incubation period. It creates that spongiform vacuole formation in the neurons. It causes those amyloid-like plaques. Those plaques are very similar to what we see in other neurodegenerative conditions like Alzheimer's, Huntington, etc. And in patients, what we see is a loss of muscle control, shivering, tremors, dementia, and eventual death. So in a case from 2006, a 30-year-old man consulted his family doctor because of fatigue and inability to concentrate. The symptoms were attributed to a respiratory tract infection. Neurologic exams at this time were normal. History was significant for the fact that during surgery 7 years earlier, he had received packed red cells, including blood, from a donor who died 1 year later of variant Creutzfeldt-Jakob disease. Variant Creutzfeldt-Jakob disease is it's a very similar form to Creutzfeldt-Jakob, a neurodegenerative condition. It's just faster. Within 6 months of his initial presentation, the patient had difficulty maintaining balance, a tendency to stagger, memory problems, a tremor in his hand, and pain in his legs. At this time, there was no evidence of changes in vision or mental status. After another 6 weeks, mental status and memory decreased. Balance and walking became difficult and painful. MRI and an EEG indicated changes in the brain, and a new blood test showed the presence of the variant Creutzfeldt-Jakob prion protein. The mental status and physical ability continued to decline. He became mute, bedridden, poorly responsive, and died 8 years and 8 months after the transfusion. So if we do the math, he died between 1 and 2 years after the development of his symptoms. So a lot of these symptoms do seem very similar to somebody who's got Alzheimer's or Lewy body dementia or any of those other kind of neurodegenerative conditions, but the decline is so quick. Western blot of autopsy samples contained the protein. Plaques and spongiform encephalopathy were noted in the brain. Because of the long incubation period for prion diseases, prevention of transfusion transmission of Creutzfeldt-Jakob is difficult. Variant Creutzfeldt-Jakob has a more rapid onset of disease. In this case, shows the classic presentation through the 5 stages. Incubation period of about 6 years, fatigue and difficulty concentrating of about 18 months, progressive neurologic decline for the next 9 months, late neurologic phase that lasted about 4 months, and terminal phase, which was death. Immunoblot analysis of treated prion protein can now distinguish the scrapey version of the protein from samples that can be taken from the patient's tonsils or at autopsy from the brain. So the way that they do the Western blot for this would be they have antibodies against this protein. They've made antibodies against this protein. And so what you would do is basically you would isolate protein samples from your patient and you would digest them with protease. And remember, the cellular form is sensitive to protease, so it should be chopped up into smaller pieces. But the scrapey form is resistant to protease, so you would see a band representing a much larger protein. So if you see the large protein, that means the patient has the prion form. If you see small portions that were broken up by protease, that means the patient has the normal form of the protein. With the patient in the previous case, he had the variant form of Creutzfeldt-Jakob, which progressed more quickly. For standard Creutzfeldt-Jakob, the incubation period could be something like 30 years. So a very long time. Those of you who are going to be working in medicine, or even if you've ever given blood, one of the questions when you give blood is, did you ever live in the UK during this particular time period? And that's because they had a really big outbreak of mad cow in the UK. in the late 80s, early 90s. And so if you ever lived there, theoretically, you could be exposed to prions. You could be incubating a prion disease, and so they don't want your blood in the bloodstream. When symptoms begin, the neurologic symptoms, not the fatigue, but the actual neurologic symptoms, death is usually within a year or so. And again, what you're seeing happen is you have the normal form of the protein, and then you get this misfolded form, this aggregate form, and it converts the normal form into the bad form. And it forms that vacuole in the neurons, which leads to the spongiform encephalopathy. And then this misfolded form basically can form those amyloid type plaques. So there did not used to be diagnosis. You could suspect it because of the rapid onset of disease, but there didn't used to be a way to confirm that a patient had a prion disease. So some of the novel diagnostics to diagnose prion diseases include using MRIs, elevated protein levels, doing those Western blots, or even in vitro aggregation assays. It's tricky because you don't want to actually work with these tissue samples, right? Because the prions are so practically indestructible, and you don't want to have them anywhere. I would not want to have them anywhere near me in a laboratory setting. But again, Dr. Gousset has worked with prions before, so you could always talk to her about them if you're interested. I find them too scary for me. There are no treatments available though. So unfortunately, once a patient has a prion in their body, that is a death sentence. So how do we prevent prion diseases in people the best we can? Well, it's hard to prevent genetic conditions. It's impossible to prevent sporadic conditions. But for the acquired infections, one thing that really helped was ending cannibalism. And if you are interested in history, if you research Kuru, there was a population in Papua New Guinea that practiced cannibalism of the dead. It was considered how you honored your relatives who died was you ate them. And again, that might sound strange to us, but that was very, very normal for them. And if a patient had died of a prion disease and then their body was consumed by their relatives as an honor, those patients would then develop the prion disease and die and be eaten and perpetuate the cycle. So by eliminating cannibalism in those people, it really helped to stop the cycle of prion diseases. One of the major factors, I guess, that led to things like mad cow outbreaks, especially in England, was the practice of, and again, this sounds gross, but if an animal died, like let's say you have cattle, if a cow died, you basically would render the cow and feed it to your other cattle. So I guess it is a type of cannibalism, but it was unintentional. Cows don't normally eat other cows. So by removing animal products from livestock feed, that really helped. And then of course, in a surgical setting, like let's say you are the pathologist who is doing the autopsy on a patient who may have died of a prion disease, you have to sterilize the surgical tools by autoclaving for an hour. Normally we autoclave for 15 minutes. You could use a 5% bleach solution, 1 molar sodium hydroxide. For me, I would just get rid of them. I would never use those tools again because I would never want them anywhere near me. But in a surgical suite, if you operate on a patient who is suspected to have a prion disease, that's how you can sterilize the tools.